So Alzheimer's disease is extremely common. It's estimated that over 5 million individuals in the United States right now suffer from the stage of Alzheimer's disease we refer to as dementia. And that works out to be more than 1 out of every 9 individuals over the age of 65 who are affected by Alzheimer's disease. Because we're doing such a good job of keeping people alive longer from their cancer and their heart disease, we really are creating an epidemic of Alzheimer's disease. So that 5 million is expected to triple in the United States over the next 20 to 30 years. It's also a worldwide problem because Alzheimer's disease affects every nation that we know of on Earth. And so it's estimated right now that we have about 30 million Alzheimer's disease patients around the world, and that's expected to go up to 80 million over the course of the next 25 years. So we don't yet fully understand completely all of the causes of Alzheimer's disease. What we know is that there's a protein that builds up in the brain over time in Alzheimer's disease that we call amyloid or amyloid beta. And as this protein builds up, it forms plaques in the brain and also forms smaller clumps. And some of the seminal work on this was done by Dr. Selkoe here at the Brigham over the past 2 decades. And we know that as amyloid builds up in the brain, it makes nerve cells, or what we refer to as neurons, work less well, and in particular, the connections between nerve cells. We also know that amyloid increases the toxicity that we see in another pathology in Alzheimer's disease called tangles. So it used to be that we could only make a definitive diagnosis of Alzheimer's disease after death. And one of the real breakthroughs in the field over the past decade is that we now can see evidence of Alzheimer's pathology in the brain during life using PET scans. So using the same kinds of dyes that we used to use in the microscope after someone passed away, we can now see in life through tagging specific proteins in a PET scan. And now we can see evidence of amyloid plaques during life. What we know is that the amyloid plaques begin to build up years, maybe even decades, before people get to the stage of dementia. Here I'm showing you an example of a normal older individual who doesn't have any evidence of amyloid plaques, so all the blue there are really just non-specific uptake. And in the bottom row is a patient who has Alzheimer's disease, very mild dementia. Was just diagnosed a few weeks before the scan was done. And what you can see here in pink and yellow are areas in the brain where amyloid plaque is already accumulated. So right now, the only therapies that we have available for Alzheimer's disease that are FDA approved and available for patients are what we refer to as symptomatic. And that means that we're trying to help the brain work better by increasing the chemicals that are important for one nerve cell to talk to another. And these symptomatic therapies do have beneficial effects, but we know that they don't really change the underlying process of the disease. So A4 stands for Anti-Amyloid Treatment in Asymptomatic Alzheimer's Disease. That's a mouthful, so we refer to it as A4. And this trial will identify individuals who are older, between the ages of 65 to 85, who we believe are at high risk for progressing to Alzheimer's disease dementia over the course of the next few years. These individuals will be screened using a PET scan that can detect amyloid plaques during life. And individuals who have evidence that amyloid's already beginning to build up in their brains, but who don't yet have symptoms that are suggestive of Alzheimer's disease. And we will treat them in this trial for 3.5 years and see if we can slow the progression of Alzheimer's disease and prevent the memory decline. So the idea of tertiary prevention or treatment is these are individuals who already clearly have symptoms due to Alzheimer's disease, usually at the stage of dementia. And unfortunately, although those trials are still ongoing and I'm excited about some of the new therapies, I'm concerned that this is too late to treat people. We all want what's called primary prevention. This is that we'd find something safe enough to put in the drinking water of everybody over the age of 18 and prevent Alzheimer's disease changes from even beginning in the brain. So we prevent amyloid plaques from ever forming at all. That's going to be a tough trial design, and I think we're not quite ready to do those primary prevention trials. But what we are ready to do, and will begin as part of the A4 trial here at the Brigham, is to do what we call secondary prevention. And the idea of secondary prevention is that we find individuals in whom the disease we believe has begun in the brain. These changes are occurring, but they're asymptomatic, so we don't yet see the clinical manifestations of the disease. And we're trying to, through a secondary prevention, prevent the onset of memory loss and progression to dementia. So if the A4 trial is successful and we can show that using the immune system to help the brain clear out amyloid, we'll move to a vaccine and we'll be able to vaccinate everybody before they develop Alzheimer's disease pathology altogether. So I foresee a day where someday we'll vaccinate everybody over the age of 18 or 30 and prevent Alzheimer's disease altogether.